And Dr. Dan Tomlinson joins us now to answer some of your medical questions. Thank you for being here.
It's great to be here tonight. You
All
bet.
right, first question. One News 10 Facebook friend wants to know how to prevent carpal tunnel. I've actually wondered this. She spends about 7 hours a day typing. She doesn't have any symptoms, but she wants to keep it that way.
Okay, well, she does have a job that she's slightly at risk for. Let's first introduce carpal tunnel syndrome is compression of the median nerve. It's a nerve in the wrist. There's a band called the flexor retinaculum that can compress that nerve, and repetitive lifting motions, that would be the worst. Like if you worked in a lumber mill or a laborer and you're lifting with your wrist flex, but also typing. But you can protect yourself at that typing job by keeping your wrists in a neutral position. They sell all kinds of things so that your wrists are neutral when you're typing, and that, so really I think most people kind of get through that. It's more the lifting thing but if you do start getting carpal tunnel, there's two things. There's the conservative and then the surgery. The conservative is to wear wrist splints that keeps the wrist in a neutral position. And actually you wouldn't think about it, but nighttime is when the problem, if it starts during the day because of lifting or whatever, then the nighttime we all sleep in the fetal position. So that's with the wrist flex like this. And so with the wrist splints you keep it straight. The other thing is surgery is very easy to do. It's a low risk surgery. And so when folks get carpal tunnel syndrome, it's pretty easy to fix.
Okay, well, we do have another question. How do you help babies who have seasonal allergies? Are there any medications that can work for them?
Well, allergies are allergies, whether you're a newborn or an adult. And it's antihistamines and nasal steroids. And then, there's pediatric dosages. But I'm going to philosophize just for a moment, and I hope I don't offend anybody, but we're seeing a real explosion in childhood allergies compared to days gone by, and it's kind of a blessing and a curse because we're a lot cleaner. Moms are good about not taking their kids to daycare when there's things going around, but the problem is, according to people who study these things, is that the immune system in a child needs to have something to get, to kind of recognize, take a photo of, if you will. And if there's no infections, there's no childhood viruses, guess what? They start to attack normal things that you wouldn't really, like tree pollen, like dog dander, and so forth. So a lot more of a problem because we live in the Western society that's cleaner than it used to be.
All right, thanks, Dr. Dan. And Dr. Dan joins us each Monday to answer your medical questions. If you have a question, you may write or email him at the addresses on your screen. You may also put the question on our Facebook page. We'll be right back.